should I call my insurance company right away? And my answer to that is something I say on television in Spanish all the time. Recuerde, su seguro no es su amigo. That means your insurance is not your friend. And many people think because I'm paying my insurance company, they're going to be on my side. Remember, the insurance company is on their side. They're not on your side. I'm going to be able to share some information. Hold on a second. The rooster is kind of talking and interfering with the podcast. Hi everyone, it's Dr. Silverman, and I want to thank you for joining me today and listening to some of the words of wisdom that I'm going to be sharing with you when you get involved in an auto accident or just basically when you need chiropractic care. Because if you understand more about the process, then you can make better decisions. So one thing that people always ask me is, hey doc, how many treatments am I going to need? You know, that's an interesting question because my answer is, I have no idea at this point. Because how do we determine how many treatments you need? We do it by doing a thorough examination. We check your spine. Most times we take x-rays. There may even be other testing that we do in order to determine the type of treatment and how much treatment you're going to need. You know, people say when I tell them that they have to come and say 3 times a week, oh, I have to go that often? And I say to them, let me ask you a question. If you went to the gym and you hired a trainer and the trainer said to you, if you come in 3 times a week for 90 days, you're going to see a big change in your body. And after 90 days, you say, hey, I don't see a change. But instead of coming 3 times a week, you only came in for the workout once a week. Would you expect the same results? Of course not. That's why you didn't build any muscle. It's the same thing with chiropractic. We work on you consistently in order to create a structural change in your body to take the pressure off of the nerves so your body can heal itself. And most people don't realize drugs don't cure. They only cover symptoms. When you do get well, it's because your body does the healing. So this is something that unfortunately the people in this country are like not really understanding. Because people think, and you've been bombarded by the media, you got a headache? Take an aspirin. Upset stomach? Take Pepto-Bismol. All of these medications, you've been programmed to not even think about what is the cause of your problem. If you only thought about what the cause of the problem is, you would be able to make change in diet and exercise and other things that you do, getting chiropractic care to prevent problems from coming and to help your body fight off different types of health issues. And so that's really what chiropractic is all about. And what I'm going to be doing shortly is going over some x-rays with you. I really want you to understand when we make decisions as to how much treatment you need, it's based on an examination and x-rays. And if you can see what we deal with on the x-rays, you'll get a better understanding as to when chiropractic is necessary and, even more importantly, how much treatment you need. Now we're going to go over some x-rays with you, give you a little bit of a better understanding of what we deal with as chiropractors. Because you can have a spine. This is a picture of a person's spine. And you can have, this is what we call a scoliosis, which is a curvature of the spine. But what people don't understand is you can have a curvature like this and not necessarily have any pain. And then what happens is you have this underlying problem there, and what ends up happening is you get involved in an accident. This is supposed to be straight. So what happens is you get into an accident and you get trauma, you get an impact in the spine, and it may not even have to be a big impact. But when you have an underlying problem, then the problem can get really bad, really fast, and you say to yourself, why is it so bad? I hardly had a big impact on this accident. Because it's like having a sleeping dog, something that's been there for a long time, it's been waiting, but it's sleeping. And then you kick it and it's angry. That's what happens in your spine. When you get an impact, all of a sudden now you get muscle spasms because this is out of alignment. You get a pulling on one side and a slackening in the muscles on the other side. and the bones begin to rotate. You get more pressure on the nerve, you get more spasms, you get numbness, tingling, cramping, all kinds of symptoms from an accident that you might not even think was very severe, but you had an underlying problem in your spine and you didn't know about it. This is why we tell people, if you get involved in an accident, come in and get an examination, because we can see what's going on in your spine. We can determine the treatment necessary in order to make a change. Now let's see what the spine should look like. This is a patient with scoliosis. Now this is a picture of another patient with a spine that's really nice and straight. This is more like the way it's supposed to look. Now, can we take an x-ray of someone who has a bad scoliosis and make it look like this? In all honesty, no. Do we have to do that in order for you to get great results? No. All we have to do is make enough change that we can take the pressure off of the nerves. Once the nerves are functioning normally, the muscles begin to function more normally, the inflammation goes down, the pain goes down, and eventually it disappears. So you don't have to have a perfectly straight spine in order to feel perfect. And this is what we do over and over again. And these problems are often misdiagnosed. People get unnecessary surgery and take a lot of unnecessary medications, which have a lot of side effects, when with chiropractic, which is completely and totally natural, you can get better results than you ever expected. A lot of times people say to me, Dr. Silverman, should I call my insurance company right away? And my answer to that is something I say on television in Spanish all the time. Recuerde, su seguro no es su amigo. That means your insurance is not your friend. And many people think because I'm paying my insurance company, they're going to be on my side. Remember, the insurance company is on their side. They're not on your side. And the reality is they may give you information that may not even be accurate. And my recommendation is wait a little bit. You don't have to report it at that moment, because many times people don't have much pain right away. Sometimes they have no pain right away. And then days or even weeks later, guess what? All of a sudden you have pain. But if you call the insurance company and say to them, no, I feel fine, I don't need any treatment, I think I'm going to be good, and then weeks later you're going for treatment, they may say to you, but I thought you said you didn't have any pain. Why are you getting treatment? So you don't want to create any issues. So my recommendation is get involved in, if you do get involved in an accident, as I say, call me first or DM me at Silverman Care. We can evaluate you and see what injuries, if any, you've had in the accident. So here's the question. The question again, how much treatment do I need? The answer is, it depends. We look at everything. We look at the degree of injuries that you have. We see the spine, we check the muscles, we do orthopedic and neurologic testing, we take x-rays, sometimes we even do MRIs. It all depends on the problem. But the process in general is, at the beginning, the patients come fairly often, 3 times a week, sometimes every day. It depends on how acute and how much spasm and what we're dealing with in your case. But usually within about 2 to 3 weeks, we do a re-examination, we check your progress, we see how you're doing, and at that point, we make a decision as to how much more treatment you're going to need. But like I said, I've been doing this for a long time, and I've taken care of a lot of people, so I have a lot of experience in this area. I don't want you to get any more treatment than you actually need, but it's even worse if you get less, because then you don't get the results you really want. And that's the name of the game. Results, results, results. And if you happen to be a chiropractor watching this video, it doesn't really matter where in the United States. Everything has become global. So no matter where you are, if you're interested in being part of our community, and I'm sure we'll be able to help you, either DM me at Instagram at Silverman Care, or subscribe to our channel, at least like us and follow us. And I look forward to hearing from you.